Hello and welcome. I'm Dr. Donna J. Smith, a medical education specialist with Genova Diagnostics. I am a naturopathic physician and a licensed acupuncturist. This webinar will focus on the inflammation and immunology section of Genova's GI Effects Comprehensive Stool Profile. Inflammation is one of the 5 pillars of GI health featured on the front page of the GI Effects report. Highlighted in the orange are the specific biomarkers that contribute to the algorithm that generates the scoring. We will be discussing all of these biomarkers as we proceed with the presentation. The GI effects biomarkers for inflammation and immunology include calprotectin, eosinophil protein X, and fecal secretory IgA. First, let's focus on calprotectin. Genova Diagnostics is responsible for bringing calprotectin to the market and obtaining FDA clearance for stool calprotectin as a biomarker differentiating IBS, irritable bowel syndrome, from IBD, inflammatory bowel disease, such as ulcerative colitis and Crohn's. All other labs offering stool calprotectin submit their assays to Genova for validation in order to claim FDA clearance. Calprotectin is released from the intestinal mucosa and is an indicator of neutrophil-mediated inflammation. It is useful in differentiating IBS from IBD and monitoring IBD treatment. Elevated calprotectin indicates an active state of GI inflammation. Several considerations when calprotectin is elevated include IBD not in remission, colorectal cancer and polyps, chronic NSAID and proton pump inhibitor use, infection, diverticular disease, history of bariatric surgery, and age younger than 5 or greater than 60. When calprotectin is less than 50, it is considered normal. When between 50 and 120, this is suggestive of low-grade inflammation. Interventions include identifying and addressing the causes of inflammation. This could be suspected history of IBD, infection, chronic NSAID or proton pump inhibitor use, or diverticular disease. Consider anti-inflammatories such as fish oil and reevaluate in 4 to 6 weeks. When calprotectin is greater than 120, it is considered abnormal and warrants referral to a GI specialist to rule out IBD, malignancy, or other causes of significant GI inflammation. There are several other markers to consider on the GI effects report if calprotectin is elevated. Fecal occult blood is blood not evident to the naked eye and present in microscopic quantities only. The presence of fecal occult blood may indicate GI inflammation or infection. Please note that if the patient has an active bleeding state, such as hemorrhoids or menstruation, it may interfere with fecal occult blood testing. Another marker to consider if calprotectin is elevated is the presence of white blood cells. The presence of white blood cells indicates an immune response that can be seen in infectious conditions and inflammatory bowel disease. Before we move on to the next biomarkers, let's do a brief review of immunoglobulins. There are 5 types of immunoglobulins, also known as antibodies: IgA, IgD, IgE, IgG, and IgM. Immunoglobulins play an important role in immune response by identifying foreign pathogens and facilitating their elimination. The different immunoglobulins vary in structure and therefore function. Immunoglobulin A is involved in the first line of defense against foreign pathogens and is found at high levels in the fluids made by mucous membranes, such as tears, saliva, respiratory and intestinal secretions, and colostrum. Immunoglobulin D is found in minute quantities in the blood, and its function is still not yet clearly understood. Immunoglobulin E is associated with allergic reactions and stimulates histamine release. Immunoglobulin G is part of the secondary immune response against foreign pathogens. It is present in the largest amounts in blood and tissue fluids. IgG is the only class of immunoglobulin capable of crossing the placenta, providing some degree of immune protection to a developing fetus. IgG is also secreted in mother's milk, conferring immunity to the infant. And lastly, immunoglobulin M is the first antibody made by B cells when fighting a new infection. On the GI effects report, there are biomarkers associated with immunoglobulins E and G. An IgE-mediated food allergy reaction has immediate onset within minutes to hours, and symptoms can be mild to life-threatening. The histamine release symptoms include hives, congestion, itchy tearing eyes, GI symptoms such as vomiting, cramping, and diarrhea, as well as swelling, shortness of breath, wheezing, as well as anaphylaxis. 90% of all food allergy reactions are caused by 8 foods: milk, soy, eggs, wheat, peanuts, tree nuts, fish, and shellfish. The recommendation for identified food allergies is avoidance. An EpiPen is also a consideration, especially for those with a past history of anaphylactic reaction. There is allergen-specific immunotherapy in which a trained clinician desensitizes someone to a particular food or allergen to decrease their reactivity when exposed to that allergen in the future. This is done by a trained specialist, and the patient is under close supervision. IgG-mediated food sensitivity reactions can be difficult to detect because the onset is delayed and can occur days after the food is consumed. The symptoms range from GI symptoms, headaches, congestion, muscle and joint pain, skin rash, fatigue, behavioral changes, and other vague symptoms. IgGs can also transfer through mother's milk, which is why when a breastfed baby has eczema, colic, vomiting, or skin rashes, the baby may be reacting to a food in the mother's diet. IgG food sensitivities can also be associated with increased gut permeability. And for treatment, consider the elimination challenge diet to identify the offending foods and addressing underlying contributing factors such as dysbiosis, issues with digestion and absorption, intestinal permeability, and nutritional status. Now, getting back to the biomarkers on the GI-FX stool profile. Eosinophil protein X is an indicator of eosinophil-mediated inflammation. There are several associations with elevated eosinophil protein X. IgE-mediated true food allergies and atopic dermatitis, inflammatory bowel disease, certain parasitic infections, in particular Giardia, Cryptosporidium, and some intestinal worms, microscopic colitis and gastritis, eosinophilic GI disorders, and eosinophil protein X can be elevated in children younger than 4. There are several therapeutic considerations when eosinophil protein X is elevated. Consider assessing for IgE-mediated true food allergies utilizing Genova's IgE food antibody panel. If IBD is suspected, correlate with the calprotectin level. Evaluation for parasites is included on the GI effects report. Support with anti-inflammatories such as turmeric and omega-3s, and mast cell stabilizers such as vitamin C and quercetin. The next biomarker to discuss is fecal secretory IgA. Fecal secretory IgA is a nonspecific indicator of an immune response happening at the gut barrier. It is recognized as the first line of defense in protecting the intestinal epithelium from pathogens and toxins. Considerations when elevated: evaluate for the root cause of immune upregulation and inflammation. Consider infection or potential pathogen, IgG delayed food sensitivity reactions and celiac, defective epithelial barrier and gut permeability, as well as colon cancer, IBS, and GI dysbiosis. Also worth noting is low fecal secretory IgA, which may reflect a loss of GI immune resiliency. Therapeutic considerations for elevated fecal secretory IgA: address infection if present, assess for compromised intestinal barrier function with Genova's intestinal permeability assessment, and there are several options for assessing food sensitivity reactions. The elimination challenge diet is one way to identify reactive foods. Another option for identifying reactive foods is Genova's IgG food antibody profile, as well as celiac assessment. Next, let's discuss several optional add-on markers. Zonulin family peptide is a nonspecific indicator associated with intestinal inflammation. Clinical significance of an elevated zonulin family peptide is unknown. Elevations may relate to increased intestinal permeability. Consider follow-up testing with Genova's intestinal permeability assessment. Fecal lactoferrin is a biomarker of neutrophil-mediated inflammation. It is expressed as a positive or negative finding, and calprotectin is considered a more sensitive biomarker of neutrophil-mediated inflammation. Revisiting the first page of the GI effects report, we see there are therapeutic support options in the white for each pillar of GI health. When fecal secretory IgA is elevated, considerations may include the elimination challenge diet to identify reactive foods, and or food sensitivity testing with the IgG food antibody profile. If increased gut permeability is suspected, consider mucosal support with mucilaginous herbs such as slippery elm, althea, aloe, and DGL for healing and soothing, and gut repair with zinc carnosine and L-glutamine. If eosinophil protein X is elevated with associated histamine release, consider quercetin as a mast cell stabilizer. Anti-inflammatory options include turmeric and omega-3s. And if calprotectin is elevated, a GI referral is recommended. Now, several case studies. Here we have a 39-year-old male with a history of IBD, in particular ulcerative colitis, following a carnivore diet. Calprotectin is elevated, consistent with IBD, not in remission. Eosinophil protein X is also elevated, which can be consistent also with IBD, but if the patient has signs and symptoms of histamine release, still consider IgE-mediated food allergies. Also, white blood cells were detected by microscope, and the patient is positive for fecal occult blood. All findings are consistent with ulcerative colitis not in remission. Next, we have an 84-year-old female presenting with diarrhea, abdominal pain, weight loss, and hives. Results show that eosinophil protein X is high. Due to the hives, diarrhea, and abdominal pain, all indicators of histamine release, consider IgE-mediated true food allergies and follow up with Genova's IgE food antibody profile. Also consider anti-inflammatories such as turmeric and omega-3s, and mast cell stabilizers like quercetin and vitamin C. The fecal secretory IgA is also high, indicating several possibilities. Remember, this is a nonspecific indicator of an immune response occurring at the gut barrier. It could indicate increased gut permeability, which is likely given the level of inflammation indicated by the eosinophil protein X, and may benefit from a gut healing protocol. Another consideration is IgG delayed food sensitivity reactions and celiac, for which an elimination challenge diet and or IgG food antibody testing and celiac testing could be considered. And fecal secretory IgA can be elevated in the presence of a potential pathogen, which we see Klebsiella pneumoniae grew out in culture. Potential pathogen means that some patients are symptomatic and others are not, and the main symptom with Klebsiella is diarrhea. For treatment, consider the sensitivities provided at the end of the report. Here we have a 64-year-old male presenting with urgent diarrhea, gas, and cramping. He recently returned from a 2-week backpacking trip. Eosinophil protein X is elevated into the yellow, which is the high end of reference range. One reason eosinophil protein X can be elevated is with parasites. Further in the report, we see that Giardia is detected by microscope, and Genova does a double check for the 6 most common parasites with PCR, and Giardia is detected here too. Here we have a 27-year-old female with alternating constipation and diarrhea, gas and bloating. She is preparing for pregnancy and is taking pancreatic enzymes. Here we see no elevation of the inflammatory and immunology markers. Fecal secretory IgA is less than 150, which is the lowest reportable finding. This is notable for several reasons. The presence of potential pathogen that grew out in culture. Pseudomonas is consistent with diarrhea, and it appears here that the fecal secretory IgA is not mounting an immune response at the gut barrier. Furthermore, many blastocystis were detected by microscope as well as by PCR. Again, further indication that fecal secretory IgA is not mounting an immune response at the gut barrier. So let's review page 2 of the report, where we see an elevated methane score of 10, making us suspicious of methane production, one of the gases that's associated with SIBO and often presents with constipation. And Methanobrevibacter smithii is reported in the 5th quintile on the PCR commensal bacteria page, adding to the suspicion of a methane type SIBO. As a reminder, the GI effects report is not diagnostic for SIBO. The SIBO breath test is. However, there are several markers on the GI effects report that can point towards SIBO, and the methane dysbiosis score and the presence of Methanobrevibacter smithii on the commensal page are 2 of them. Now let's talk about the zones. Genova has polled data for patients who had a positive methane SIBO report and they had done a GI effects report in a similar time, and Genova looked for associations between the two. And what they found is in the commentary for zone 2, which indicates that methane SIBO can be associated with impaired intestinal barrier function or immune suppression. This is shown on the GI effects report as a low eosinophil protein X and a low fecal secretory IgA. This then allows for the presence of opportunistic infections such as blastocystis. So, the possibility of a methane type SIBO can be associated with impaired intestinal barrier function, evidenced by low eosinophil protein X and a low fecal secretory IgA, allowing then for the presence of opportunistic infections such as blastocystis and potential pathogens that grow out in culture. Additional educational resources may be found on Genova's website, gdx.net. These resources include a comprehensive GI support guide and charts, as well as a test preparation page, and a learning library that features a variety of videos and webinars. Be sure to tune in to Genova's The Lab Report podcast, available on Apple Podcasts and gdx.net. And medical education consults are available by scheduling online through your MyGDX portal or calling Genova's client services team. And one-on-one as well as group consults are available. Thank you for your attention. And on behalf of the Genova Diagnostics Medical Education Team, we look forward to assisting you.